And welcome back to JKLIVE Live here at Citizen Television. What an incredible conversation we're having. We had almost forgotten, folks, that we're living amongst COVID. Pandemic hasn't gone anywhere. But when Dr. G and Dr. Lois show up, they're reminding us we're not yet out of the woods. That's the bottom line. And like I said before the break, folks, you came in with your mask. You still have, look at you.
Yes, I still have my mask. I still wear my mask.
You still wear it? Dr. G, you too?
Yes, I do.
A lot of people have dropped the mask thing.
Yeah.
And washing hands too, some of them, huh?
Absolutely. Yeah. You know, even shaking hands.
Yes.
Jeff,
yes.
You know, these days, today I was in a meeting and you go, and you, it's like a game. You do this because some guys are like, you know, then so it's changed, you know.
Yes.
We thought people would not come back to shaking hands.
Right.
But no, so it's a game every time. You don't know. You know, and sometimes you look rude, you know, so it's difficult.
Yeah.
I think we must remember that in the whole strategy of disease prevention, some measures are just basic hygiene measures. Washing hands, shaking hands, they're just basic hygiene measures. They don't have to be related to COVID. The more hands you shake, the more likely you're going to pick up a bag. It doesn't have to be coronavirus. Could be anything else, yeah? So I think those measures, we need to adopt them as a population. The less hands you shake, the better. Now, secondly is the measures around, as we're talking about, social distancing and mask wearing. Those you use based on the disease situation. They are based on surveillance data, because if you say stay at home because you have the risk of getting coronavirus, then you must remember also that staying at home impacts people's education, social lives, and economic development. So you have to measure when do I tell people to stay at home? When do I tell people to get back to work? So when the infection rates are low, you allow people to go back to business. Does that mean the risk of infection is zero? No. It's just a choice between risk and benefit. It's the same with masks. It's risk and benefit. So when there's a surge like there is now, that's where the ministry said, please now wear your mask, because you're more likely to get infected now than you were 2 months ago. So now wear your mask. And even most importantly, wear it when you're going to a closed room. She talked about the positivity and the risk of infection in closed doors, crowded, that have a closed room. So you have to understand. I think the most important thing, Jeff, is people understanding not the ministry directive, but understanding the science behind why they need to socially distance, they need to wear their mask, they need to wash their hands. It's not about ministry directives. It's about community awareness and empowerment of people to make choices about their lives and the lives of others they love.
Absolutely. Dr. Lois, I saw you nodding throughout, huh?
No, I agree. I think it's about giving people enough information to know that this time we have higher rates and your risk of getting an infection is high. And also thinking this time the rates are low and your risk is low. And for people to have that information and know what to do with that information, so that now when we have high risks, people need to wear their masks, you know. When the risks and the rates are low, then you can drop the mask for a while, then pick it up again. So people have to respond to what's going on around them. Yeah.
Absolutely. And remember, and I think we all need to remember that, we are not doing this just to avoid hospitalization. You're doing this to protect other people who you can put at risk to end up in hospitalization. That's going to affect your life. If your mother ends up hospitalized, whether you got hospitalized or not, it affects your life. If your uncle or your father got hospitalized, it affects your life. But secondly, even this, we tend to ignore outpatient illness a lot. You know, Jeff, if you got COVID today and you have severe sore throat, cough, you're going to be out of work for 10 days. So why risk being out of work? And a big population of our country is actually informal. So if you're a mason or you do plumbing and now you have a sore throat and you have to stay at home because your fever is so bad, you're going to lose 10 days of work. Why? Wear your mask, not only for hospitalization, but so that you can actually assure yourself to continue working and feeding your family.
Yeah, good point. There's a question here. A colleague contracted COVID in January and got sinusitis, which to this date has never healed. She's forced to use a humidifier.
So I think that means sinusitis.
Okay.
So sinuses are these air spaces around the face. So you have some around your cheekbones, some just above the nose, and occasionally they may get inflamed and they may fill with fluid and some cells, and that causes pain and discomfort, and someone has difficulty breathing and they feel they are congested. You know, they say, I feel like something is full around my face. So that can happen with many infections. Some people get it because of allergies, some people get it because of viral infections. Often it's because of viral infections. So if someone has sinusitis, there are a few things they can do to feel better. One, they can take an antihistamine. They can take something to reduce the inflammation, maybe something like diclofenac. Just a single tablet may be important in reducing that inflammation. For some, it may get very bad and get even more infection, in which case they need to see their doctor so that they see how best to make sure that fluid that's sitting there is drained. But often just the home remedies may help. And as I said, some people may get it because of allergies, so it may be good to check your house and say, is there dust in the house, things like carpets and curtains and pillows that may need to be changed, may need to be put out in the sun, that may reduce some of these allergies. So yes, sinusitis can occur. Is it necessarily because of the COVID? I'm not sure, may or may not be, maybe because of either other infections or some allergies as well. So they need to look for that as well.
Very good. Doctor, anything to add?
Nope, perfectly said.
All right, let's go to the magic wall, because there's lots and lots of reactions from across the country and around the world. Lots. It's good that people are still thinking in this way, thinking of protecting themselves. So here, in tweets, Binya Wamuli says, I did a COVID vaccination last year outside the country for Johnson in July. Is there any risk if I do another in Kenya and get registered, as I was given a manual card which can't be loaded on the MOH site? Dr. G?
So these are around policies of registration and recognition of vaccination schedules or regimens. And now if someone, she says, Mbinya, yeah?
Yes.
You did yours in July, even if you have to consider the second ones as a booster, because even for Johnson & Johnson now, there are considerations as to whether the one dose was adequate, and there are many feelings by scientists that the one dose, needs a repeat dose later. So my advice is just take an extra. It's now July, I hope it's last year?
Last year.
Yes.
Last year, yeah.
Yes.
So it's time, get another Johnson and get registered in the Kenya data so that you have a global vaccine certificate for travel. It's safe for you, boosts your immunity, and gets you registered.
And Johnson is available here?
It's available.
Okay, Okello Mwalimu, ask the two good medics, when are we likely to commute COVID-19 from being a pandemic to being an endemic? Or has it happened? Secondly, on a scale of 1 to 10, can they rate government's response towards curbing virus prevalence? So from being a pandemic to being an endemic.
Yeah.
So I guess the simple difference is that a pandemic is something that comes as a new disease, causes a widespread infection and high mortality. So if you think about when COVID was announced as a pandemic, I think it was sometime around March of 2020. That was a time when we were seeing an incredibly high number of infections, and the deaths were also high in many countries around the world. So that's when it was declared a pandemic, meaning every country must take specific responses to reduce the rate of infection. When we say something is endemic, it means it's now become part of life, You'll find a few cases at any one time in different places around the world. It's no longer causing as much devastation in terms of severity of illness or in terms of death as when we have a pandemic declared. So I think at this point, just because of the mortality that we're still seeing with COVID-19 and the number of infections that are still being seen globally, I don't think it's yet time to de-escalate it to level of endemic. With endemic, there are always a few sporadic cases here and there, but without the large illnesses and mortalities that are seen. And I think they may think in Kenya, is it about to be endemic? But these are global decisions, because declaring something a pandemic influences issues around borders. Countries may say, now I'm going to close my border because there's a pandemic. It influences issues around release of funding for response to diseases and the like. So in many other countries in the world, there's still a high mortality and very many cases. So I think it's still a space that not yet endemic at this point. It probably will become endemic with time, but not yet at this point.
All right. Dr. G, the second part, can you rate the government's response towards curbing virus prevalence?
Lois, what's your view? 1 to 10. What do you think?
He is passing the buck to me. So this is, I'm not sure I'm qualified to rate the government. It's a little above my pay scale. But I would say this. I think when we think about rating a response, it's around how well were you able to curb the number of infections? How well were you able to provide care for those that were sick? How well did you reduce mortality? But you see, that is looking at it from a health care lens. For COVID-19, there's so many lenses. There was education, there was economy, there was agriculture, there was tourism. So there are very many lenses, and I think this is one way to be unfair to totally just think of health as the only important thing. So back to you, Dr.
I would say, because, the colleague here is looking for a number, I would say based on all the factors that Dr. Lois has said, based on what I've seen globally, looking at Africa, I would say that Kenya would be probably in the upper quartile of countries that did very well, generally. I don't know if I can say 1 to 10 or not, 10 means perfect, I'm not sure. But I would say it's in the upper quartile of countries that has a very solid and robust response, followed science, put a team of scientists together and listened to them. So I would say that it did very well.
You're saying globally or in Africa?
Globally.
Globally.
Wow.
Yeah.
Since we're part of the response, we'll score them a high grade.
All right. Anunda Ogega is asking, if COVID keeps on changing its wave, can the initial testing kit for COVID-19 be effective for the current virus?
So that's an interesting question. We know that sometime last year, there was an issue about certain kits, not all kits, certain kits not being able to detect some viruses. But I think most kits have been fairly good in detecting the virus because some of the proteins, so to speak, that are detected by this kit sort of remain conserved or are maintained even with changes. So it's not the entire virus that changes, it's components of the genetic makeup of this virus that changes. Some remain the same, and those ones are detected by multiple kits. Agree?
Okay, Bob Kaugi is saying there are known side effects of the vaccine, blood clotting included. What if the 12% is being registered by the flu and not COVID?
I think I have a very simple answer to Bob. The 12% positivity is people tested for COVID and tested positive. It's not clinical diagnosis. It's not saying anyone with a cold or cough. It's 12% of people have cold or cough. It is people who've been tested for COVID and were positive. So the 12% is actually positive, tested, laboratory tested cases. I think that rests that debate.
Yeah. Very good, very good. C.K. Ateli asked the guests the link between COVID-19 vaccination and risks of developing diabetes.
Wow, I haven't heard of that.
I haven't heard of that. I think what's the relationship between risks of developing diabetes is not with COVID vaccination. It's with COVID itself. Because in COVID-19, and Dr. Lois has been in the front line here, we know that there are people who are pre-diabetic or whatever you may call it, but because they got COVID-19 infection, that infection destroyed further their pancreas, and therefore they tipped over to actually become clinically diabetic. That's what we are aware of, not through COVID vaccination, but through COVID infection.
Yeah. At the height, many times when we have a surge in COVID, we see a lot more people presenting with high blood sugar or diabetes. Many times it's transient during the period when they're sickest, and after the COVID, the blood sugars tend to go back to normal. But if you have someone who was diabetic even before, then the blood sugar becomes very difficult to control when they have the acute illness, and then it may improve thereafter. But I haven't seen any good data to associate the vaccine with diabetes.
Okay. Jomo Gigi Mukuru is asking, ask Dr. Gitahi, what is the rationale of the government talking about COVID-19 control and threatening to reintroduce the stringent restriction measures, yet political campaign rallies are having a field day without caution, yet the government is mum on this?
I cannot protect the government, and I cannot talk about political rallies. I think I can just go back to the point I talked about earlier, that COVID and protecting yourself against COVID-19 infection is not a government mandate. It's an individual mandate. And I think we have moved now over 2 years more to empowered communities that make decisions on what is relevant for them at any one time. The government, of course, when it's talking about reintroducing mandates like they did for masks, is doing so to protect the health system and protect health workers and protect the economy. That's what, so they're looking at the macro, what we call the macro issue. But deep down, it's each of us to say, do I want to go to this rally? Do I want to wear a mask? Do I want to enter this room without a mask? It's individual. I think it's reached a point where it is more relevant about what we think about ourselves than what the government says. Yeah. That's what I would say.
And maybe one of the things to note globally over the last 2 years, we've seen countries that were approaching an election period having some of the highest rates of COVID-19, and some were devastating. I think we saw this in Brazil, for example, in India, for example. There are times when there were political, heightened political activity that was often followed by high rates of COVID-19. But I think I like what Dr. Gitahi said, that when you see these mandates brought up, it's to protect us in the healthcare system. We don't want the hospital to be full, then we can't take care of you. But your individual protection is up to you. You have to make the decisions everybody has to make the decisions for themselves.
Absolutely. Well put, well put. Omanyo Rama says, after getting 2 doses of COVID-19 vaccine, do I still have to wear a face mask? Or at how many percentage rate can I get the COVID-19 infection?
Okay.
Well,
I think, and he asks a good question. I think we were all of the hope when this started that you'd get vaccinated and you'd have 100% protection and you could drop masks. But COVID has turned out to not quite behave the way we wanted it to behave. So that we know, even with vaccines, post-vaccination, as we said earlier, immunity wanes. It may not totally protect against acquiring the infection. It may protect you from going to the hospital very sick, but not necessarily against acquiring the infection or transmitting to the other people. And I think this is something we've said over and over. We don't know everything about COVID yet, and we'll have to learn the lessons. But until we learn that lesson, people should not be the victims. Let them protect themselves so that when we learn the lesson, they're alive to celebrate the lessons with us.
Carol Nduta wants to know, hi Jeff, ask the good doctors whether there is a chance in the near future for home testing kits so that we don't have to go for testing in hospitals or clinics and wait hours for results. Home testing kits anytime?
Actually, there are some self-test kits that are available in the market. People can buy them in the pharmacies. I think what the government needs to put in place is a way of reporting some of the self-tests, because you do it on your own, you have it, you stay at home, nobody knows about it. But there are self-test kits that are available in the market.
All right. Okay, time for some closing thoughts going forward. Dr. Ari, we're in election year, 40 days and 40 nights to go.
You had to say that.
You want me to comment on the elections or the 40 nights, the 40 days?
Like Dr. Lois said, after that, you might see the numbers going up again, huh?
Yes, of course. We know that activity that brings people together presents the best opportunity for viruses and other infections to spread. And coronavirus is no different. The more you aggregate together, the more you get together. If you have one person who is sick who is at home, they are less of a risk to you. But when that person who is sick comes to a political rally, stands next to you and shakes your hand, and then you touch your nose or whatever is going on around there, then you're more likely to get infected. So I think that we are going to see more and more risk as we go more and more towards this political period. And that's why I said at the end of the day is personal choice. You have to make a choice. And also that choice means if you're sick, stay at home. Make a choice to stay at home. And if you think you're well and you think you're going to a place where you're going to present a risk to yourself, whether you think you're vaccinated or not, it is something that you need to make a choice about. Do I need to be here? If you need to be there, go ahead. Risk is never zero. You'll never have zero risk anywhere. It's about measuring the risk and saying, do I need to take this risk? And if it's a yes, go ahead and take it. Yeah.
Dr. Lewis?
I think for me, it's about what people should do when they're sick and what they shouldn't do. So in the last few weeks, just because so many people have gotten a running nose, a cold, a sore throat, or the flu, whatever they want to call it, many times people want something to make them feel better. So what can you do to feel better? One, when you have that congestion, the fever, you can take some Panadol for the fever. You can take an antihistamine to reduce this running nose and the congestion. And all those other home remedies, and gargle some salty water, it may improve the throat. What shouldn't we do? One, let us not take antibiotics for the common cold or the flu or for COVID, because these are viruses. Antibiotics work against bacteria. So it doesn't matter whether you take it or not, it will not help you get better faster, but it makes the bacteria within you become resistant to antibiotics. And in future, if you need an antibiotic, we may not have an antibiotic for you. So we have to think about, don't use antibiotics if you do not need them. The other thing is also, I guess, some reassurance for everybody that even though we are seeing high rates, people are not too sick. So no fear, but protect yourself so that you're not the statistic that ends up in the hospital. So wear your mask.
Absolutely. Dr. Lois Mbajos, infectious disease specialist, University of Nairobi, thanks so much for your time.
Thank you.
I kept my word, right? Dr. Gideon Gitai, thanks so much. Group CEO, Amref Health Africa. Thank you so much for your insights, folks. Really appreciate it. I just need to go back to that wall if you guys don't mind, but thank you so much. Here's good news for M-Pesa customers. You can now get global payments using funds in your M-Pesa. The world is yours with M-Pesa Global Virtual Visa Card. Safaricom have partnered with Visa to enable you to shop and make secure payments around the world using funds in your M-Pesa wallet. And here's how you go about it. Oh, let me just ignore that real quick. Yep, ignore it. All right. Here's what to know. Download the M-Pesa app from your Google Play Store, App Store right now to access M-Pesa Global Virtual Visa Card, or simply dial *334#, select Lipa na M-Pesa, then select Global Pay. With M-Pesa Global Virtual Visa Card, the world is yours. And thanks so much for being a part of JKLIVE today. Very informative show. I hope you're listening, folks. It's all up to you at the end of the day. Put that mask back on, wash those hands, and we don't have to go back to zero where we first started off. It's all up to you. Thanks so much for being a part of the show. Every Wednesday, it's all about those three letters on the big billboard that on the keyboard that follow each other. JKL. Thanks so much, folks. Good night, good luck. Oh, it's end of June. We'll see you back here in July. Good night, everybody.